Peace. It's Censored Barbie, aka Sharon Michelle here. I thought I would share some information with you guys because I went to the hospital the other day for my hands. They're much better now. And they wanted to give me naproxen, which I found was funny because first she goes, "Here, we're giving you something for pain." I see naproxen, she thinks I'm stupid apparently, and I go, "That's not for pain, that's for inflammation and it doesn't work." She goes, "Oh, well, this is what the doctor wants to give you." I'm like, "He wants to give me some useless thing that's not going to help me, it's going to hurt me." She goes, "Well, this is what the doctor wants to give you," because that's what they know how to do, just repeat what they were told. So that's what she kept saying. But I went home and did my due diligence and went ahead and looked up the side effects. And you can go to drugs.com. Drugs.com, I find, is an awesome website because it not only gives you information for the consumers, it also gives you information for the professionals, for the doctors. Stuff that they can read and they think that we can't understand. So basically in yours, it's just going to say all the side effects, which they make you think are weird effects that only some people get, when in actuality it's the effects of the medication. They just call them side effects because they're the unwanted effects. But so it's just going to tell you the effects of the medication, but for the professionals and the doctors, it's going to tell them information about clinical trials and research studies and other information, diseases that are caused by this, articles, information, anything that's been published. So what you want to do is look through the consumer's part first to really scare the shit out of yourself and educate yourself on what you're really taking. And then you want to look at the professional part. And the best way to do that is to have an open mind and believe what you read. Because trust me, these doctors, they're not lying to each other. They're just lying to you. Okay, so here's the most common side effects. If you're ready, this is going to be a 20-minute video. Belching, bruising, difficult or labored breathing, feeling of indigestion, headache, itching skin, flat, large, blue, or purplish patches on the skin, pain in the chest below the breastbone. This is for pain and inflammation, and it's already causing pain. Skin eruptions, stomach pain, swelling, tightness in the chest. It's already caused 2 different types of pain in 2 different areas of the body, and you're taking it for pain. Then there's bloating, bloody or black, tarry stools, blurred or loss of vision, burning, upper abdominal or stomach pain, more pain. Cloudy urine, constipation, decrease in urine output or decrease in urine concentrating ability. Disturbed color perception, double vision, fast, irregular pounding or racing heartbeat or pulse, halos around lights, loss of appetite, nausea or vomiting, night blindness, overbright appearance of lights, pale skin, pinpoint red or purple spots on the skin, severe and continuing nausea, severe stomach burning, cramping, or pain, skin rash, swelling or inflammation of the mouth, troubled breathing with exertion, tunnel vision, unusual bleeding or bruising, unusual tiredness or weakness, vomiting of material that looks like coffee grounds, weight loss. Anxiety, back or leg pain, bleeding gums, blindness, blistering, peeling or loosening of the skin, blood in the urine or stools, blue lips and fingernails. This is where it really starts to get good. Canker sores, change in the ability to see colors, especially blue or yellow. Ding, ding, ding. Clay-colored stools, chest pain or discomfort, more pain. Cold sweats, coma, confusion, cool, pale skin. Cough or hoarseness, coughing that sometimes produces a pink, frothy sputum. Bitchin'. Let's see. Cracks in the veins. That can't be good. Cracks in skin, darkened urine, decreased vision, depression, diarrhea, difficult burning or painful urination. Painful. Difficult swallowing. Difficult, fast, or noisy breathing, dilated neck veins, dizziness, dry cough, dry mouth, early appearance of redness or swelling of the skin. Later on it says the opposite of that too. Extreme fatigue, eye pain, fainting, fever with or without chills, fluid-filled skin blisters, flushed, dry skin, frequent urination, fruit-like breath odor, greatly decreased frequency of urination or amount of urine, hair loss, high fever, hives, increased hunger, increased sensitivity to skin or sunlight, increased sweating, increased thirst, increased urination, increased volume of pale, dilute urine, irregular breathing, joint or muscle pain, Large hive-like swellings on the face, eyelids, lip, tongue, throat, hands, legs, feet, or sex organs. Yippity-doo-dah-day. Late appearance of rash, with or without weeping blisters that become crusted, especially in sun-exposed areas of the skin. May extend to unexposed areas. Wow, this is awesome. Light-colored stools, lightheadedness, loss of heat from the body, lower back or side pain, nervousness, no blood pressure, no breathing, no pulse. Hello? That means you're dead. Nosebleeds, numbness or tingling in the hands, feet, or lips, pain in the ankles or knees, pain or burning in the throat, pain or discomfort in the arms, jaw, back, or neck, painful red lumps. Under the skin, mostly on the legs, pain in the stomach, side, or abdomen, possibly radiating to your back, pale or blue lips, fingernails, or skin, pounding in the ears, puffiness or swelling of eyelids or around the eyes, face, lips, or tongue, rapid, shallow breathing, red, irritated eyes, red skin lesions, often with a purple center, red-green color blindness, redness or other discoloration of the skin, redness, swelling, or soreness of the tongue, scaly skin, seizures, severe sunburn, shakiness, skin thinness, slurred speech, sneezing, sore throat, sores, ulcers, or white spots on the lips or tongue or inside the mouth. This is not all. Sores, welting, or blisters, spots on your skin resembling a blister or pimple, stiff neck or back, stomach cramps or tenderness, stomach upset, swelling in your legs and ankles, swelling in your face, fingers, feet, or lower legs, swollen, painful, or tender lymph nodes in the neck, armpits, and groin, tiny bumps on the inner lining of the eyelid. That sounds really aggravating. Unexplained weight loss, unpleasant breath odor, watery or bloody diarrhea, weakness or heaviness of the legs, weight gain, yellowing of eyes and skin. Now people, these are the minor side effects now. Continuing ringing or buzzing or other unexplained noises in your ears, hearing loss. These are the most common side effects for naproxen. They don't tell you these. So the most common are continuing ringing or buzzing or other unexplained noises in your ears, tinnitus, or hearing loss. Hearing things in your ears or not hearing anything at all. That sounds really fucked up. Less common, acid or sour stomach, change in hearing. Didn't they just say that was common? Feeling of constant movement of self or surroundings. I think that's vertigo. Passing gas, sensation of spinning, stomach soreness or discomfort. A little more rare. Appetite changes, burning, clawing, itching, numbness, prickling, pins and needles or tingling feelings, burning, dry, or itching eyes, difficulty with moving. What? Paralysis, possibly? Discharge, excessive tearing. Don't ask me. Well, general feeling of discomfort or illness. No shit. Lack or loss of strength. Menstrual changes. Muscle aching, cramping, stiffness, or weakness. Not able to concentrate. Redness, pain, or swelling of the eyes, eyelids, or inner lining of the eyelid. Seeing, hearing, or feeling things that are not there. Right. They make you psychotic. Great. Shakiness in the legs, arms, hands, or feet, swollen joints, trembling or shaking of the hands and feet, trouble getting pregnant, trouble performing routine tasks, trouble sleeping, unusual drowsiness, dullness, or feeling of sluggishness. Wow. Wow, 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 wow. Okay, and these are the problems that they got. 10% or more found that they had dyspepsia, whatever the hell that is. 14% or more found they had heartburn, nausea, constipation to be common. Up to 10% found diarrhea and abdominal pain common. People also reported pancreatitis, flatulence, gastritis, vomiting, dysphagia, stomatitis, abdomen enlarged, eructation, GI hemorrhage, rectal hemorrhage, mouth ulcers, stomach ulcers, cardiospasms, colitis, esophagitis, gastroenteritis, GI disorders, rectal disorders, tooth disorders, melanoesophageal or ulcer, hematemesis, non-peptic GI ulceration, ulcerative stomatitis, something else I can't say, inflammation, bleeding, ulceration, pulveration, obstruction, exacerbation of inflammatory bowel disease. I mean, this goes on and on and on and on and on. Cognitive dysfunction, poor concentration, convulsion, stroke, migraines, neuralgia, neuritis, amnesia, paralysis, nephritis, interstitial nephritis, nephrotic syndrome, renal papillary necrosis, kidney function abnormalities, creatine increase, glaucoma, BUN increase, renal failure, renal disease, kidney pain, kidney failure. It even causes cancer, okay? It causes carcinoma and breast carcinoma. If you don't know what that is, that's cancer. It also causes all these, I mean, I can't even go through this long list of diseases that it causes. I wouldn't even be able to read all this to you, okay? There's no way. I've already spent 10 minutes just reading you the side effects of naproxen. Now, this is something that you guys can do all by yourself. Look up the medications in your home. Go to drugs.com and look up the side effects of the medication in your home. It is insane. These drugs, how can they possibly stop pain and inflammation if they cause pain and inflammation? You heard me. How many different types of pain and inflammation did you hear that it causes? And they use it to stop pain and inflammation? You people need to use your brains, okay? These medicines are not medicines. They're not medicine. They're poison. These medicines are filled with toxic chemicals that they're pumping into your body and telling you that it's to make you better. You guys need to use common sense, use a little logic, okay? Look some stuff up, do a little research, stop believing everything that you hear. I'm not driven by money, I'm not trying to sell you anything. The only thing I'm trying to do is educate you. Help you to be able to educate other people. Stop poisoning yourself, stop poisoning your children, stop poisoning your pets. No one needs this bullshit medication. You don't need heart medication, you don't need blood pressure medication, you don't need anything. The only thing you need is a diet change. That's what you need. Stop putting all the chemicals into your body, start eating fresh fruits and vegetables and nuts and grains and berries. Stop eating all the processed foods. Slow down on your meat and animal product consumption. Those are also filled with lots of chemicals, hormones, GMOs. They feed those animals horrible chemicals and antibiotics and poisons, and then that stuff goes straight to you. Okay? Milk has an okay amount of pus and white blood cells in it. It's not okay. This stuff is disgusting. You put it into your body, and they sell it to you as something good for you. The last thing that you should do is have to question your own doctor. But I'm telling you, they don't know any better. The corporations that own everything also get paid to go and teach in schools. They teach vets and doctors and pediatricians that all this stuff is good for you. Better yet, that you need it. That you need treatment for your illness instead of finding the cause of your problem and stopping that. Because I promise you, for every problem that you have, there is a natural cure. You can stop doing something. You can start doing something. You can do a combination of stopping and starting doing things. You could be doing a lot of bad things you don't even realize you're doing, like eating things. So, do yourself a favor. Look into what's in your medication. Look into what your medication does. Look into what your medication is supposed to be prescribed for, and then ask yourself why you're taking this. Why do they use antidepressants for psoriasis medication? Why do they use anti-seizure and anti-convulsion medications for headache medicine? Why? Why are they doing this? And why are they selling it to you under those false pretenses? Why do they get to change the name of a drug when it becomes really harmful and people find out that it's killing a bunch of people? Why do they get to change the name and sell it as something else, like Prozac? Why do they get to do that? Ask yourself these questions. Find out answers for yourself. And stop poisoning yourself and your children with these unneeded, harmful medications that are actually poison. Think about it, people. Educate yourselves, okay? For your own health and safety.